Every 67 seconds, someone in the US develops Alzheimer's. By the time you finish this video, dozens more will face it. Today we'll uncover the true progression of Alzheimer's, from invisible warning signs to the life-altering late stages. And wait till you hear the one symptom doctors say often appears years before memory loss. Quick challenge. How many stages of Alzheimer's do you think there are? Guess in the comments now. The real number might surprise you. The invisible beginning. What if the first stage of Alzheimer's starts years before you notice a single symptom? According to neurologists, brain changes can begin 20 years before obvious signs appear. Imagine your brain quietly building plaques and tangles while you feel perfectly fine. These microscopic changes disrupt neuron communication long before memory loss kicks in. That's why early brain health checkups matter. Don't wait for forgetfulness. Prioritize sleep, stress management, and physical activity today. The disease begins long before symptoms surface. Early damage hides in plain sight. Mild cognitive impairment, the overlooked red flag. Ever forgotten a friend's birthday or misplaced your keys? We all do, but when these slips increase and affect decision-making, it might signal mild cognitive impairment, MCI. MCI bridges normal aging and Alzheimer's, yet it's often dismissed. Roughly 12 to 18% of people over 60 experience it, and half develop Alzheimer's within 5 years. Catching MCI early means you can adopt brain protective habits that may delay progression. Notice recurring forgetfulness or disorientation. Don't brush it off. Talk to your doctor. Mild signs often mean major problems ahead. Forgetfulness or something more. Is forgetting a name now and then normal or a warning sign? Occasional memory slips are typical with age, but consistent forgetfulness, like missing appointments or repeating questions, deserves attention. Studies show this symptom often marks the earliest functional decline in Alzheimer's. What's alarming? Nearly 40% of early cases go undiagnosed because people dismiss these moments as harmless aging. If patterns emerge, track them. Use a daily journal or brain health app to log memory slips. Early patterns reveal hidden risks. Track forgetfulness. Patterns expose problems. The personality shift nobody expects. What if someone you love starts acting unlike themselves? In early Alzheimer's, subtle personality and mood changes often precede memory issues. Calm individuals may become anxious, irritable, or unusually suspicious. According to the Alzheimer's Association, these shifts happen in nearly 60% of cases during early stages. It isn't just getting older, it's the disease-altering brain chemistry. Don't ignore sudden mood swings or odd paranoia. Early awareness can mean earlier care and a better support plan for everyone involved. Behavior changes before memory loss. Trouble with planning and familiar tasks. Imagine suddenly struggling to follow a recipe you've cooked for years. Difficulty with planning, organizing, or handling familiar tasks is one of Alzheimer's clearest early signs. It's not just misplacing your phone, it's forgetting how to use it. A study from Johns Hopkins found these executive function struggles often appear before serious memory loss. Watch for trouble managing finances, following directions, or keeping track of bills. Spotting this decline early can buy precious time for intervention and support. Routine tasks shouldn't feel impossible. Disorientation, losing track of time and place. Ever found yourself in a room and wondered why you were there? Harmless, right? But for someone with early Alzheimer's, this grows into full disorientation, losing track of days, seasons, or getting lost in familiar places. According to recent research, spatial confusion develops earlier than most expect, often even before noticeable memory issues. If a loved one starts missing familiar routes or forgets dates consistently, take it seriously. Use calendars, reminders, and consistent routines to ease daily strain. Disorientation strikes sooner than you think. Language and communication breakdown. Imagine knowing exactly what you want to say, but the words won't come. In early to mid-stage Alzheimer's, people often struggle to follow conversations, repeat themselves, or forget familiar words. What's alarming is that language difficulties can predict faster cognitive decline. A 2023 study showed those with early word-finding trouble progressed 2 times faster. Watch for pauses, vague substitutes like thingy, or avoiding conversations altogether. Engage loved ones in simple, low-pressure talks and consider brain games that boost vocabulary. Words fade before memories do. Disorientation, losing track of time and place. Ever found yourself in a room and wondered why you were there? Harmless, right? But for someone with early Alzheimer's, this grows into full disorientation, losing track of days, seasons, or getting lost in familiar places. According to recent research, spatial confusion develops earlier than most expect, often even before noticeable memory issues. If a loved one starts missing familiar routes or forgets dates consistently, take it seriously. Use calendars, reminders, and consistent routines to ease daily strain. Disorientation strikes sooner than you think. Language and communication breakdown. Imagine knowing exactly what you want to say, but the words won't come. In early to mid-stage Alzheimer's, people often struggle to follow conversations, repeat themselves, or forget familiar words. What's alarming is that language difficulties can predict faster cognitive decline. A 2023 study showed those with early word-finding trouble progressed 2 times faster. Watch for pauses, vague substitutes like thingy, or avoiding conversations altogether. Engage loved ones in simple, low-pressure talks and consider brain games that boost vocabulary. Words fade before memories do. The confusing world of poor judgment. What if someone you trust started giving away their life savings to strangers? Poor judgment and risky decisions are classic signs of Alzheimer's progression. From falling for scams to neglecting hygiene or dressing inappropriately for the weather, decision-making abilities deteriorate early. Experts estimate that financial mistakes often appear years before diagnosis. Keep an eye out for unusual spending, bad calls, or impulsive behavior. Early conversations about financial safeguards can prevent disasters later. Bad choices reveal hidden decline. Social withdrawal, the silent alarm. Ever notice someone gradually skipping events, ignoring calls, or isolating themselves? Social withdrawal is a subtle but telling symptom in Alzheimer's early course. Studies show over 40% of early-stage patients begin pulling away long before memory loss draws attention. They may avoid hobbies, gatherings, or family visits out of frustration, confusion, or anxiety. This isolation accelerates mental decline and emotional strain. Encourage casual, pressure-free interactions. Simple daily chats or nature walks can make a real difference. Isolation quietly worsens everything. If you've made it this far, chances are this topic matters to you or someone you love. Hit subscribe now. We cover powerful, life-changing insights about brain health, aging, and how to stay sharp long before trouble shows up. Don't let this be the video you forget to act on. Changes in movement and physical abilities. What if someone starts moving differently without explanation? Early Alzheimer's doesn't just affect the mind, it alters physical coordination too. People may shuffle their feet, hesitate before sitting, or misjudge distances. Research suggests gait changes can appear up to 10 years before diagnosis. These subtle shifts increase fall risk and reduce confidence in daily tasks. Watch for slower walking, balance issues, or stiff movements. Gentle exercise routines and balance training can help preserve independence longer. Movement reveals what memory conceals. Severe memory loss and recognizing loved ones. Imagine looking at your child's face and not knowing their name. In middle to late Alzheimer's, severe memory loss takes center stage. It's more than forgetting birthdays. People struggle to recognize spouses, children, even their own reflection. Research shows about 80% of patients by the late stage can no longer name family members. This isn't just heartbreaking, it dismantles emotional bonds and complicates caregiving. Use memory books with labeled photos and maintain a consistent daily routine to reduce distress. Faces vanish before feelings do. Paranoia, hallucinations, and delusions. What if you believed strangers were in your home or loved ones were stealing from you? Paranoia and hallucinations are terrifying realities for many Alzheimer's patients, typically emerging in moderate to severe stages. Up to 50% experience visual or auditory hallucinations. They may see people who aren't there or hear non-existent voices. While distressing, these symptoms often stem from brain regions misfiring, not mental illness. Calm reassurance and reducing environmental triggers can ease these episodes. Fear replaces reason in the mind's decline. The emotional toll on caregivers. Alzheimer's doesn't just claim the patient, it wears down everyone around them. Studies show over 60% of caregivers report high emotional stress, with nearly 40% experiencing depression. The relentless demands, sleepless nights, and watching a loved one fade away exact a heavy cost. Many caregivers neglect their own health, risking burnout and illness. If you're caring for someone with Alzheimer's, seek support groups, respite care, and regular mental health check-ins. You can't pour from an empty cup. Caregivers break before patients do. Why some symptoms improve before, declining again. Surprisingly, some Alzheimer's symptoms temporarily improve, then crash harder later. Known as paradoxical lucidity, brief moments of clarity occur in about 20% of late-stage patients. A person who hasn't spoken in weeks might suddenly recall names or share memories. Though bittersweet, these episodes don't signal recovery, but reflect dying neurons' last attempts to function. Families often mistake these moments for progress. Cherish them, but stay prepared. They're temporary gifts, not signs of healing. Lucid moments lie. Paranoia, hallucinations, and delusions. What if you believed strangers were in your home or loved ones were stealing from you? Paranoia and hallucinations are terrifying realities for many Alzheimer's patients, typically emerging in moderate to severe stages. Up to 50% experience visual or auditory hallucinations. They may see people who aren't there or hear non-existent voices. While distressing, these symptoms often stem from brain regions misfiring, not mental illness. Calm reassurance and reducing environmental triggers can ease these episodes. Fear replaces reason in the mind's decline. The emotional toll on caregivers. Alzheimer's doesn't just claim the patient, it wears down everyone around them. Studies show over 60% of caregivers report high emotional stress, with nearly 40% experiencing depression. The relentless demands, sleepless nights, and watching a loved one fade away exact a heavy cost. Many caregivers neglect their own health, risking burnout and illness. If you're caring for someone with Alzheimer's, seek support groups, respite care, and regular mental health check-ins. You can't pour from an empty cup. Caregivers break before patients do. Why some symptoms improve before declining again. Surprisingly, some Alzheimer's symptoms temporarily improve, then crash harder later. Known as paradoxical lucidity, brief moments of clarity occur in about 20% of late-stage patients. A person who hasn't spoken in weeks might suddenly recall names or share memories. Though bittersweet, these episodes don't signal recovery, but reflect dying neurons' last attempts to function. Families often mistake these moments for progress. Cherish them, but stay prepared. They're temporary gifts, not signs of healing. Lucid moments lie. Final stage, total dependence. By the final stage of Alzheimer's, independence disappears entirely. Patients lose the ability to walk, speak coherently, or control basic bodily functions. According to the Alzheimer's Association, individuals in this stage require 24/7 care for feeding, bathing, dressing, and even swallowing. It's a profound, heart-wrenching decline that leaves families emotionally and financially drained. Preparing ahead with care plans, advance directives, and hospice options ensures dignity and support during this final chapter. The body remains. The person fades. Hope on the horizon. New treatments in development. For the first time in decades, real breakthroughs are within reach. In 2023, the FDA approved Lecanemab, a drug that slows Alzheimer's progression by targeting amyloid plaques. And more promising therapies like donanemab and tau protein blockers are in advanced trials. While not a cure, these treatments can delay severe decline by months or even years. Stay informed. Clinical trials and early interventions could open new doors for families facing this disease. Hope is no longer hypothetical. The role of lifestyle changes in delaying onset. Could diet, exercise, and mental challenges really delay Alzheimer's? Absolutely. Research shows that regular physical activity reduces risk by up to 30%, while diets rich in antioxidants and omega-3s protect brain cells. Cognitive training and social engagement also build cognitive reserve, helping the brain compensate for damage. It's not magic. It's science-backed lifestyle medicine. Start small, walk daily, eat colorful veggies, and keep learning. Your brain's future depends on it. Healthy Habits by Brain Time. The one early symptom you should never ignore. There's one early Alzheimer's symptom often overlooked: difficulty with smell. Losing the ability to detect odors can precede memory loss by years. Studies link impaired olfactory function to early brain changes, especially in regions affected by Alzheimer's. If you notice sudden changes in smell or taste, don't shrug it off. Mention it to your doctor. Early detection saves precious time. Smell reveals what memory hides. Alzheimer's is much more than just forgetting names. It's a complex, gradual transformation that affects the mind, body, and relationships. Awareness and early action can slow the disease's progression and make the journey easier. Be vigilant for subtle symptoms, develop brain-healthy habits, and support caregivers who shoulder the emotional burden. Next, Alzheimer's and oral health, why it matters. Subscribe to stay informed and empowered. This video is for informational purposes only and does not replace professional medical advice. Always consult qualified healthcare providers regarding diagnosis and treatment.